back. Welcome back to my YouTube channel. My name is Paige. I'm a nurse. I've been a nurse for 32 years, and now I am a patient advocate. So I help people navigate the healthcare system. I've worked mostly in critical care. So I worked in, let me just adjust my camera a little bit. I've worked in emergency rooms. I've worked in trauma ICU. I've flown with air ambulance. And yeah, now I am, for the last 8.5 years, I've been a patient advocate. So I help people navigate the healthcare system, all of the ways that people can fall through the cracks. And we all know what those are. There's a lot of them. I try and hopefully help avoid people from doing that. So, and if you've seen my videos, you'll understand the things that I'm really passionate about. So I'm just really happy to be here. My goal is to help you advocate for yourself better, be your own best advocate. Unfortunately, it's not exactly fair, but it's the way that our system is right now. We need to be our own advocate. We need to be our own quarterback of our healthcare. So that's my goal, is to help you navigate the healthcare system and become your own best advocate. This afternoon, it's all about you. I want to hear, it's a live Q&A, so please start dropping your questions in the chat. Anything that you want to, anything you're wondering about, dealing with doctors, preparing for appointments, understanding your rights as a patient, ask away. I love it when you guys share let me just fix my computer there. I'm getting a glare off on my glasses. I love it when you share your experiences, and it's interesting because on these lives, and I've noticed it on my TikTok lives too, that people, when they start to share their experiences and things that they've gone through, usually there's someone else on this live that has gone through something similar, and then people start to kind of share their experiences, share resources, offer encouragement. And it's actually kind of cool. So while you're kind of thinking of your questions, you can also just sit and watch too. That's totally all good. I'd love to know that you're not bots and that you're real people. So you could just even say a quick hi. But while you're thinking about that, I have a few topics that we can dive into. If there's a quiet moment, we can talk about there's a few things that I've thought about that have come up. How to prepare for specialist appointments to get the most out of it, because we wait months and months and months and sometimes years for these specialist appointments, and then you're in and out of there in like 10 minutes. So really important to make the most of that time. So I thought we could talk about that. I thought we could also talk about, and this one comes up a lot. Well, one is all the different biases in our healthcare system. I've talked a lot about that. But what to do when you feel like a doctor isn't listening to you, or not believing you, or is dismissing you, or is maybe, condescending you. I thought we could talk a little bit about that. Hi, Martin, as well. And then I also thought about when and how to get a second opinion. That's always a good one that people want to know. The power of keeping a health journal, like keeping track of your own medical records, that can be really good as well. But really, it's for you. I want to hear from you. I want to hear your questions. And if you put stuff in the comments that I miss, that if it's not applicable, if it's not anything to do with our what we're talking about, then I just won't even acknowledge it. But Henry, hi, I see you on there. No, I don't. I have a moderator actually, so thank you for offering, though. I appreciate it. I do. There are some filters on here, so if your message has something, and I didn't put the filters on, but I think YouTube did. If you find that your messages are getting held back or deleted or whatever, just maybe try wording it in a different way so that I cannot miss that. So anyway, so let's get started. If you're just joining on here too, my name is Paige. I am a patient advocate. I've been a nurse for 32 years. I've worked in healthcare. I've worked in critical care, mostly. I've worked in emergency rooms. I've worked in trauma ICU. I've flown with air ambulance. And I've worked a little bit in mental health and addictions as well, like an inner city addictions unit, a detox. I worked in a little bit in the OR, a little bit in the recovery room, and now I'm a patient advocate, so I help people navigate the healthcare system. So hi, Shart, good to see you. Good to see you guys on here. And so that's kind of what my videos are about. This is a Q&A. It's also, if you want to share, if you have questions, obviously. If I don't know the answer, I will say so, and I will I'll try and find it for you. But yeah, if you have experiences too that you want to share, it's really kind of cool. I just mentioned this, but on a bunch of my lives, people will share an experience that they've had, and then usually someone else in the live has also had a similar type of experience, and then resources are shared, encouragement is shared, and it's really kind of cool to watch that. So feel free to, I want this to be a safe place. I want you to be able to share whatever it is. I do my best to moderate people that come on and say things that are, either rude or whatever. I'm pretty good at deleting them. I sort of learned that skill on the fly. I'm not the greatest at it, but I don't acknowledge when people are being rude or disrespectful on here, and then I get rid of them. So, or if they say things that aren't relevant to what we're talking about, because this is really, hi Charlie, this is really a intentional, safe place. So, hi Owen. So that's kind of what I want this to be. So that's our primary focus. I want you guys to drive the conversation if you can, but it's also okay to just watch and take it all in. I have topics that I can, I have lots of stories for sure. Yeah, so anyways, it's good to see you guys on here. Hi again, Charlie. Let me just see. Nichar. Hi, Mo. Good to see you too. So I just want to talk about, there's one thing that comes up a lot. I've talked about this in other lives, but I wanted to just bring it up here quickly before we kind of get into some questions and stuff. But it's the healthcare, it's the biases that happen in our healthcare system. So there are a lot of them, and I've talked a lot about them in my videos. If you haven't checked out my videos, just subscribe and you'll get, I try and do at least 2 a day. Sometimes I do 3. Some of them are a little spicy, a little controversial, and my heart is not to scare people. I'm not on here trying to trash the healthcare system or doctors. There's a lot of amazing doctors out there, and I know a lot of them. Unfortunately, it's just like anything, right? They're not all equal. They're not all awesome, and so yeah, it can just be really tough. So. Let me just see. Oh, I'm so tired. Okay, Bruce, I'm not going to acknowledge that. Henry, can you tell us about how hard it is to be a doctor? Yeah, so there's a lot of schooling, right? There's like 7 years minimum of schooling. And actually, that's part of what is going on in our healthcare system is there's a huge doctor shortage. So there are fewer doctors graduating from medical school than ever before. So it's pretty crazy, pretty crazy. Anyways, I'm just really thankful. Just 1 second, you guys. I'm just going to, okay. There we go. I just had to hide somebody. Yeah, I do. When people are kind of being rude on here, I just bloop, out they go. So anyway, that's kind of the scoop around being a doctor. So I was going to talk about the healthcare biases, and there are a lot of them. And I don't know, and I share things on here because they're things I've seen. I've been a nurse for 32 years, and I've seen a lot of this stuff. And so it's kind of to pull the veil back a little bit on things that can happen. But the only intention is to hopefully, doctors, nurses, there's nobody that works in the system, has ever been sick in the system, has had a loved one in the system, in the healthcare system, that can deny that our system is pretty broken, it's pretty overstretched, it's under-resourced. And so it's just to raise awareness, and hopefully, if as you're navigating the healthcare system, you might remember some of these things like, oh, that's something that could happen, so I need to be proactive in that. So that is the reason. So when I talk about biases that come up, they're things that I've seen, unfortunately. They're things that I've witnessed, I've watched other healthcare workers, and it's disheartening. And so I can't not talk about it, right? Yeah, and anyways, so some of the biases, so there are socioeconomic biases. So I have videos talking about what you wear sometimes affects how it's more how you present. So if you show up and you're kind of disheveled and you're maybe you haven't showered in days, maybe you've got dirty, ripped clothes, you might be treated differently. You might be judged on that. And you might be treated differently than someone that showed up in a tuxedo. Now, if it's life and death, obviously you're not going to think about what you're wearing. And I know when I've been sick, I probably smell. I probably, like, my clothes are not clean. My hair isn't brushed. Haven't brushed my teeth. So that, like, you don't think of those things. You just kind of get into the hospital or whatever. So, and definitely if it's life and death, you don't wait around to see how you're looking. But I'm just saying, if there is I've seen it, right? I've seen it. It sucks. Like, it's terrible that it's that way. But unfortunately it is. So there's racial biases. There are gender biases. Some men get treated differently than women still. There are, like, sexual preference biases. So people that maybe are transgendered or LGBTQ or whatever, there are biases. There are just opinions that people have formed in their head. And what are some other ones, you guys? There's so many of them. I didn't write them down, but there are so many of them. But if you think of ageism. So people often think that it's just older people that get judged, like, oh, you're too old, or whatever your symptoms are, that's just part of natural aging, and you just got to suck it up and deal with it. It also happens with young people, and, well, you're too young to be sick, or you don't look sick because you're young. And there's this idea in people's minds that just because you're young, you're automatically healthy. Well, if you've got some of those invisible chronic illnesses that you can't see from the outside looking in, you might not be well, right? But you just happen to be young. So anyway, I probably am missing some of the biases, but there are a lot of them. And it's just really tough. I love to, I don't know, it's hard to do, but I try to encourage people to speak to them, right? Like, if I feel like I'm being judged because I showed up in my grubby sweatpants because I've been sick for a week and they're dirty, I haven't showered. I do have a home. I don't use, I don't use drugs. I don't, like, all these things that people will look at me and make this judgment. And if I feel like my treatment, the way I'm being treated is, if my health care is getting affected because of what I think other people are perceiving, I'll call it out. I'll just say, you know what, it feels like you are judging me because of X, Y, and Z, and that concerns me because I'm really sick and I need good care. Like, just kind of, you have to do it respectfully, which is hard when you feel like you're being disrespected. It is really hard to not lose your crap. Anyway, so I'm just going to scroll here. I just want to see if there's any messages. Elvinarda, hi. You're from Turkey. Oh my goodness, you're a teacher. When you compare it to teaching, it's absolutely very hard. It requires lots. Absolutely. It is. It's very similar to teaching. That's so great. Hi, Eagle. Good to see you on here. Oh my goodness. Okay. Arshma, I don't know. Okay, we're classmates in the 8th grade. Okay, I have no idea. I have no idea. So no, I'm not dealing with an illness. So my name is Paige. I've been a nurse for 32 years, and I am a patient advocate now. So I help people navigate the healthcare system, and that's what this live is about. That's what my channel is about. I try to post 2 or 3 videos a day. They're just short ones about different things that can happen in the healthcare system that lead to people not getting the care they need, falling through the cracks. And there's a lot of them, whether it's not getting, not being respected or believed by your doctor, not getting a proper diagnosis, not getting the care you need. Maybe it's you're in the hospital and you're not getting the treatment you need, or maybe you're being discharged from the hospital too soon. Maybe you're not being taken seriously by your doctor. Or, like, there's so many ways. So that's essentially what my videos are about. That's what my channel is about, and this live is a Q&A. So it's for people to ask questions. It's to share experiences. We can talk about different experiences that people have. And yeah, that's kind of essentially what it is. So, and Arsh, I'll just call you Arsh. You suffer from an autoimmune disease. Oh my goodness, how should one tackle a chronic health condition? So I'm not a doctor, so I can't say. I'm a nurse. I've been a nurse for a long time, mind you, but I am not a doctor. So That's a big question, Arsh, right? Like when you have an autoimmune, it's complicated. The big thing that I would encourage is to really advocate for yourself, really stay on top of your own health conditions. So keep track of everything. Make sure that everybody's One of the things that can happen in something like an autoimmune or other chronic illnesses is that you've got your family doctor, right? And then you've also got maybe your rheumatologist. You might have internal medicine. So you've always got these like other doctors or other people in the healthcare system, and they don't talk to each other. So you really need to make sure that they're communicating. That's a big important piece, so that everybody's on the same page with your healthcare and that you've got a really good plan in place. That's really good. So, okay, I don't see any other questions there. So I don't really acknowledge questions that are not related to patient advocacy or the healthcare system. So I just kind of skip over those. So anyways, yeah, because people come on here and they might share vulnerabilities. Like it's quite a vulnerable place. It's a live that is supposed to be safe for people. And so I try to do my best to sort of moderate things. There's also filters on here. So if you find that your questions or comments are being booted, then just maybe write them in a different way or something. So I wanted to talk about one question I get a lot of, and this might help you a little bit, Ars, is it's about seeing specialists. And I'm sure that you have probably a rheumatologist or different specialists involved in your care. But sometimes you wait like months for a 15-minute appointment, and it's easy to walk out of those appointments feeling like you forgot everything. And I know I've done it too. Elvinita, unfortunately, so many illnesses stem from psychological problems. Well, it's all connected, right? Like I think our mental health, our physical health, spiritual, like we're not just skin and bones. And so I absolutely agree. I think that the two need to be treated as one, like our mental health and our cognition, psychological, and our physical bodies. And I think sometimes one of the biases that happens is that the healthcare system workers will sort of brush off some of the physical symptoms as being anxiety or depression or whatever. And you know what? It's all one. I don't think the person might have some anxiety, but it doesn't mean that their physical symptoms are not real. So Arsh, I see a rheumatologist. Fortunately, in your country, you don't need to wait months to see a doctor. Oh, the same or the next day. Oh my goodness, that's amazing. So in North America, it's not like that. That's a big wait usually. So you're in India. Okay, yeah, interesting. Thanks for sharing that. So that's pretty. There's a few countries that have a much better healthcare system. Like the way that it's set up is much better than North America. We are quite a bit further behind, in my opinion. So that's amazing. So here you can wait like 18 months to get in to see a specialist. So, and then when you get in, you have a really short window of time to actually get everything talked about and discussed with that doctor. So I teach a lot about preparing for that. And if there's, just kind of like putting together kind of a one-pager, like everything on one sheet with all of your questions, your main concern, whatever medications you have, being really specific with what your concern is. Like say you have knee pain. You've had it for 6 months. What started, like what was going on that started it? What makes it better? What makes it worse? How is it affecting your quality of life? What things help with the pain? Like, and being really, really specific and have it on a sheet of paper, because you know what, you can even just hand the paper to them and the questions that you really need to have answered. And don't go more than like 3 or 4 questions because you just don't have time. So your most important priorities. And then always, if you can, I know not everybody has somebody, bring someone with you. And I'm just really passionate about this because I've seen it so many times where it can be a complete game changer, you guys. Like the dynamic can completely change when there's a third person, a third party in the room, kind of for a lot of different reasons. Maybe the doctor is a bit more accountable. So there's a third party now listening in. It's not just two people. There's a third person there. That person can take notes for you. That person can help you ask questions that you might forget. They can kind of be a support person. They can validate, like if you have a doctor that tends to dismiss your symptoms or not believe you or blame it on, I don't know, mental health stuff or whatever, they can kind of have your back. So they can say, oh yeah, actually Paige, her pain has been bad. Like she hasn't been able to work. She can't walk around the block. It wakes her up when she's sleeping. So they can kind of have your back for that. So really, really important to bring someone with you, in my opinion. And then also before the end of your appointment, and I see this happen a lot, is to really make sure that you have the next steps. Like, what are the next steps? What do I have a follow-up appointment? If they've given you a requisition or a referral, well, what's the doctor's name that you gave me a referral to? And get that name written down, because you can phone and follow up with that doctor and just to make sure that your referral went through. If you have a requisition for a test, like when am I going to hear the test results? When might I hear from the MRI place? Those kind of things. So it's really important to have a plan and just to kind of summarize things, because so many times in doctor's appointments, they will, say all the stuff. This is what we're going to do. Well, let's do this. And it's all scattered. And then they get up and leave. And you're sitting there going, well, okay, I think he said we're doing this, but I don't know, like, am I supposed to phone? Is he supposed to phone? And I've done this myself. So anyways, I don't know. I'm a big believer in having it written down, going in there, because in a pinch, like there's some people who they kind of freeze when they see the doctor, right? It's called white coat syndrome. So they get nervous or whatever, or they get frazzled. Or if you are feeling like crap, if you're sick, you might forget stuff. Like it's really easy to have happen. Or if you have a doctor that's kind of dismissing you or gaslighting you, your emotions can get heightened and you kind of like, So anyways, so really important to like have the paper there with you. You can choose not to give it to them, but in a pinch, you can just give it to them. It's got everything written down there, and boom, you're done. But before the end of the appointment, make sure you have like, what are the next steps? And then you can also have them like that. Kind of, it leaves them a bit accountable too, because if they say, well, I want to see you in 2 weeks after your CAT scan, and after you've seen I want to see you in a month, say, after you've had your CAT scan, after you've had blood work, and after you've seen this specialist, then you can follow up, right? You can say, well, you said that X, Y, and Z. Why haven't I got a call for this CAT scan? Why haven't I been referred to this doctor yet? So really, really important. Okay, I'm just going to scroll here really quick. Make sure I don't miss anything. Darlene, hi, welcome. I'm glad that you're on here. Arsh, thank you for the advice. Oh, you're welcome. I hope good health and good luck with your health too. And you're welcome to stay on here. So if you're just joining on here, my name is Paige. I'm a nurse. I've been a nurse for 32 years. I worked in critical care. So emergency rooms, trauma ICU, I flew with air ambulance. I worked in the recovery room. I worked in the operating room. And I've worked in a few different places in the hospital and the community. And I also worked in mental health a little bit. So for 4 years, I took a sabbatical from critical care. I worked in an inner city detox unit in addiction. So I love that. But that's kind of mostly what I've done. And so anyways, now I'm a patient advocate. So I help people navigate the healthcare system. So all of the ways people can fall through the cracks, that's what I try and help with. And if you haven't subscribed already for my videos, I try and do 2 or 3 a day. And they're just short, but they're videos about how to advocate better for yourself, or how to just kind of how to navigate the system. And they're things that I have seen. And so I'm not on here trying to trash the healthcare system or doctors or anybody in particular. They're just things that I have seen. I know there's a lot of awesome doctors out there. There's a lot of awesome hospitals out there. There just is, and I've seen them, but they're not all that way. And so these are things that I have seen in my 32 years, and it's kind of pulling the veil back a little bit and just saying, hey guys, like, our healthcare system is broken. Our healthcare system is under-resourced. There's not enough doctors. There's not enough resources, not enough hospital beds, and these are some things that can happen. And so as you are navigating the system, either yourself or a family member or a loved one, you can kind of remember these things. And it's about being proactive, right? And just kind of like, oh, okay, I'm noticing that my doctor's dismissing me or telling me, or he's like rolling his eyes, or he's not really listening, he's not paying attention. And in the meantime, I'm still sick and I'm not getting referrals, I'm not getting a diagnosis. So, and then you can kind of remember some tools, right? So anyways, let me just have a look on here, make sure that and you know, this is a Q&A. So if you have questions that are related to this, to the healthcare system, make sure you put them into the comments. And if I miss it for some reason, then make sure you like write it again, or just say, hey, dude, you missed that. Or if you have experiences that you want to share too. So just let me know, just put them into the comments. And it's been kind of cool because other people will then sometimes support you, or just empathize, or maybe they have suggestions or other resources. So I want this to be, my heart is really to just create a space that's comfortable, that is safe, because there aren't very many of those in our healthcare system. And so many people are not being heard in the healthcare system. They're being dismissed and not getting the care that they need. So that's what my heart is. That's kind of what this, I'm just going to scroll here, make sure I haven't missed anybody, because I don't want, Cryptic, hi, Cryptic Howl. And if I don't say your name right, interesting, you got a lot of issues. Oh, I'm sorry to hear that. Arsh wants to move to the US. Oh my goodness. Randy, hi. Hi, David. Hi, Mama. Mama B has your back. Hi, Nikki. Oh, thanks for saying hi, you guys. Then I know that it's there's actually humans on there. I kind of part of me wishes this was like set up like a Zoom where people can actually talk. Anyways, I'm glad that you guys are here. I was going to, but yeah, I want to hear from you guys. This is kind of about you. But if there's quiet, I'm totally okay if you guys just want to listen too. So it's not like I have tons of stories I could tell. I have lots of topics that come up on a regular basis. And so I'm totally fine to do that. But please, if you do have questions, then I want to hear them. I wanted to talk about, and I've mentioned it a few times here, but when you feel like your doctor's not listening, and I don't know if any of you have experienced this, I have seen it a lot. I have experienced it a little bit myself, but more when I'm in appointments with other people and I see them, there's bias. It happens for all kinds of reasons. So many reasons. Like there could be biases. They could be their ego. They could be short on time. They could have just biases, or they're judging, or they've sort of made up their mind in what's wrong with this person, or there's so many reasons that people can feel like they're not being heard or they're not being listened to. So let's talk about this. What do you do when you feel dismissed or unheard or disrespected by your doctor? It's so common, and it's a huge part of medical gaslighting. And I'm sure you've heard the term gaslighting. It is in relationships, it's talked about a lot, but it happens in our medical system, in our healthcare system. And it's not always malice. Like it's not always like a malicious intent. The doctor's probably not trying to like cause you mental anguish or trauma or stress. But remember that doctors are often rushed, and it doesn't make it right, but it's not always personal. Like it's not personal attack against you. Sometimes you just need a strategy to cut through that, right? Like there is a huge doctor shortage, and I'm not defending, because it's not right, and it's not fair, and it's not respectful, and it's not okay, in my opinion. But there's reasons for it, right? And we need to kind of be able to work through that so that we can still be heard, and that we can we can kind of get the care that we need. So sometimes you just need a strategy. So one of the strategies is, and it's going to sound kind of cliche and whatever, but it like some of those basic communication principles, like using I statements. So instead of saying like, you're not listening to me, you so-and-so, and calling them names and getting up and cursing and slamming the door, try saying like, I'm feeling like I'm really concerned that we're not addressing my dizziness. I'm just making a thing up. It's less confrontational and it's harder to dismiss. Like if you say you're not, they can just get really defensive if you kind of start attacking them. But if you just say like, I'm concerned that we're not taking this seriously and that we're not addressing it. That kind of just changes the thing, and be like a broken record if you have to. Just keep repeating your concern, repeating it over there. And if the doctor's saying it's probably just stress or it's probably just anxiety or whatever, you can say like, I understand that it could be stress. Like I get that, but I would still like to explore the possibility of an inner ear problem. Like I'm just saying if it's dizziness. And the doctor says, well, let's just watch it for now. It's probably fine. You just minimize your stress. Just try and chill. And you can say, well, yeah, I appreciate that. Like, just keep repeating it. And, but my main concern is dizziness, not my stress level. And I would feel much better if we could rule out a few things. And what would be the first step for that? Like, kind of put it back on them. So anyways, and you just keep doing that. You keep doing that and just say, I am concerned. I'm concerned. And then you ask for them to write it in the in your chart. Sorry. Could you document in my chart that you've chosen not to pursue any testing for my dizziness at this time? And when you say that, like a lot of times, and it's not to be confrontational, but it's just, it makes them pause. It's not like they're actually probably going to go do that. Some of them might. It's more, it just creates a bit of a pause for them to sort of rethink and go, oh, it holds them accountable a little bit. And I've seen it work a lot of times. The other thing that I've seen work a lot is just simply bringing out like a pad of paper like this, setting it on your lap. This is in the middle of your doctor's appointment and not your phone. It doesn't work the same with the phone because we are so desensitized to seeing people on their phones, right? But bringing out like just a pad of paper like this, setting it on your lap and have a pen. And then you just sit there like this, like you're just ready to start taking notes. And when they talk, you write it down. And then there's something that happens and I don't know, it's like an accountability thing. It's like, oh crap, this person's serious. And like, it shows that you are an active participant in your care. And like, this person is serious. They are not, I better start looking into these symptoms because they're serious. Like they're taking their health very seriously because they're there, right? Having a pad and paper, I can't tell you how many times, and not even writing anything down, just having it there. I don't know what it is. There's something psychological that happens. Same thing, you guys, when you're in the hospital, emergency, I've done it in emergency rooms, but in the hospital, like when the doctor comes in, let me just get my piece of paper because I need to take notes of what you say. And just make them pause for 1 second before they continue. Get your pad of paper out, make sure it's big, like this, not just like a little teeny thing, and not your phone. A big pad of paper, and set it on your lap, and then like, Kate, you ready to, okay, what's going on now, Dr. So-and-so? Oh, I can't tell you how many times that has helped. Anyways, okay, I'm gonna stop there. So if you've been on my lives before, you know that I'm pretty passionate about some things. I go off on these little tangents. I go down these rabbit holes, and off I go. But I always come back. So anyway, if you type in a question or a comment and it takes me a minute to get to it, it's just because I've gone off on some tangent. But I will come back. I usually pause the scrolling when I know that I'm going to be talking about something. So let me just, I'm going to scroll for 1 second and just make sure that I haven't missed anything. Okay. Oh, some good questions here. That's awesome, you guys. Okay, Swans. Oh, Arsh, it's 4 a.m. there. Oh my goodness. Swan Song, hi. Are home saturation machines as accurate as doctor office sat machines? I would say yes. They're just, I mean, any of those kind of external machines are going to be, so a SAT machine, if you don't know, it's a clip that usually goes on your finger. Sometimes it goes on your earlobe, sometimes just inside your nose. It'll clip onto your nose, but it measures the oxygen level in your blood is what it does. So it uses the little capillaries. So any of those are going to be about the same accuracy. The only real, like, truly accurate is a sample of the blood and actually measure that, right? But yeah, I would say any of those. It's same with blood pressure machines. Like, they're all fairly, the same temperature machines, all the electronic ones. The key is to use, like, if say it's like a scale, right? Like, say you weigh yourself and maybe your scale is 5 pounds off. Well, at least you know that. So you can still tell if there are changes. So just kind of knowing what the baseline is for that saturation machine is really, so the important thing is if you notice it going down, right? Like going down from what it normally records. So yeah, I would say they are fairly accurate. As accurate as an external machine can be. Let me know if that answers your question, Swan. Arsh, I have ankylosing spondylitis. Oh my goodness. Okay. You usually say, oh my goodness. Okay. And 09JFR, you usually say you'll fix it yourself. Oh my goodness. If your doctor's not listening. I know, right? It's tempting and it's so frustrating when you're being dismissed by your doctor because they're the professionals, right? So yeah, I get that. Super frustrating. Cryptic howl. When I was in college, there was a small period of time your neck would lock and unlock at times. It triggered facial trauma. It feels like facial nerve damage. What should you do about it medically? Okay, so wow. So I'm not a doctor, right? So I have to be careful what I say on here for sure. But if you've had long-term symptoms, that sounds like nerve, something with the nerves, right? I would definitely go back and get probably a neurologist to check, do a complete nerve study on you, but definitely go get that checked. As for specifics, I can't. If you have facial nerve damage, you need to see a specialist for that, for sure. I can't give that advice because I'm not a doctor, and I have to be careful on here. Darlene, we need more patient advocacy. I agree completely. I agree. It's almost like it's not a luxury anymore. It's almost a necessity. And it doesn't have to be me, like someone that's a nurse or has worked in the healthcare system. It could be anybody that really has your back and isn't afraid to kind of ask questions and that. But just not going through everything alone can be really helpful. And I know that a lot of people, not everyone has somebody. I get that. Okay, I'm just trying to have a sip of my tea there. Swan song, your oxygen after cleaning sometimes goes as low as 78, but mostly 84. You feel like you're not getting enough air and wheezing. You want to call your doctor to be checked. I'm worried that they won't listen. Well, that's pretty, so it could be that you're, 78's pretty low. So it would be hard to really have a lot of energy with that low of an oxygen. But it could be a little bit inaccurate too. It's hard to say. It might, but regardless, if you're feeling like you're not getting enough air and it's measuring these low numbers, absolutely get it checked. And if they don't listen, when you say you're short of breath and you can't breathe, that's a huge red flag. Even, that would even warrant going into an emergency room if you are having problems breathing and your oxygen is that low. And it might not be completely accurate, but that would have to be really inaccurate to be that low. So, and you're also having symptoms and you're wheezing. So absolutely call your doctor to get checked. And when you call, don't minimize. I think a lot of people, we want to be stoic, right? We want to try and be tough and whatever, but don't minimize when you're explaining your symptoms, your concerns to it, either whether it's a doctor's office or an emergency room. Don't minimize it. Do not minimize it, because then that adds to them possibly not listening or taking you seriously. So be really, really clear. Swan, your fear of calling to make an appointment roots from the fear of not being taken seriously in your appointment. You feel like you haven't been heard in the past. Yeah, I'm really sorry. So it sounds like you've had experiences where you're not being heard in medical appointments, and that's probably created some trauma, right? Like you probably have some trauma from that. So now when you actually have something, and you probably did at that time too, right? You probably had something really significant that they just weren't listening to. But you remember now that you have something else coming up where you can't breathe or you're having problems breathing, you're remembering what that felt like to be dismissed and condescended, possibly, maybe eye rolling, gaslit, whatever, all of the different ways that that you weren't taken seriously or told that it's in your head. So I totally get that. I would, when you call, I would maybe start, if this is a pattern, I would start looking for a different doctor or a nurse practitioner. But in the meantime, you still need care, right? So I would call the office and say, like, this is like you won't talk to the doctor right away, but you call and say, this is what's happening. I don't know if my oxygen saturation machine is completely accurate, but it's measuring really low at the times where I'm short of breath. And when I clean, I get short of breath, maybe explain, and I feel like I'm wheezing. And you can say, I was really nervous to call because I felt like in my last appointment about X, Y, and Z, whatever that was about, I felt like I wasn't being taken seriously, and now I'm scared. Like I have some fear about this, and I need an appointment this week. Like breathing problems is not something that can wait, or I wouldn't suggest waiting a week or two. Like I would go now. And if they can't see you, go to an urgent care center or a walk-in clinic or even emergency if you have to. But I'm really sorry that you had that experience, Swan Song. Like that's what happens is these things happen in the system. And there's lots of different things that can happen, right? And they cause a traumatic experience, and then we don't know who to trust. We become nervous. I've talked to, I don't know how many people I can tell you that I've spoken to who they only will go to the doctor if it's life or death, literally. Like they just won't go because they've been so hurt by the system. If someone can't write, can they ADA have a voice recorder during an appointment? So if someone can't, write like on this, on the pad of paper, yeah, you can record it. And I like to let them know, it's your right to have nothing missed, right? So I'm just going to record Dr. So-and-so. I don't want to miss anything important that you have to say. And don't ask for permission. Don't say, oh, is it okay if I record? No, I'm going to record it because I don't want to miss anything that you say, and I'm worried that I might miss something. Just word it like that. And so absolutely. Oh, the SAT machine in India is called finger chip. Oh, that's funny. Hi, Hasya. Zombie. Is Hashimoto hypothyroidism a dangerous autoimmune disease? It can be. It's definitely worth getting checked, for sure. For sure. Cryptic Owl. Yeah, you're welcome. Okay. Do I know anything about Behçet's disease? I've never Behçet's. I don't. But I could probably find out. Not right this second, but after my live, I could probably find out. I don't know if you have any specific questions about it. Okay. Sorry, I'm not coping. Philip, hi, I see you on there. You're from Australia. That's good. Well, I'm glad that you're here. And it's totally okay if you want to listen, if you want to share any of your experiences. We've talked about, I don't know, when you say you're not coping, I'm not sure what you mean by that, but we can jump into some things if you want. I'm totally happy to do that. Swan Song, wonderful advice. Thank you. I'm glad you worded the call for me. Yeah, you're very welcome. You're welcome. And if there's any other way that I can help, let me know. I don't use the messaging thing on YouTube. Like there is a board that you can use. But But I have a TikTok channel as well. So if you think of things and you want to reach out on there, I'm totally fine with that. Yeah. But I'm sure it will go well. But yeah, good luck with that swan song. That's definitely worth getting checked for sure. I just want to mention my book to you guys. So this isn't a pitch about my book, but somebody asked me, messaged me privately to ask if I'd mention it. So my channel is called Paige Lennox Books and Patient Advocacy. And I'm going to get back to the other stuff here in a minute. I'm an author as well. So it was originally supposed to be for my books. And that's kind of how it started. And then I wrote my healthcare book. And then people started asking me if I would post some videos about that. And that's sort of how it's transitioned into this, which is great because I've been a nurse for 32 years, a long time. And so this is really where my heart is. This is my passion. So this is great. I love it. And I do have a healthcare book. So this one is Canadian. It's Unlocking the Healthcare System, but it's basically a guidebook on how to navigate the healthcare system. And it's a guidebook. It's a manual. It's not like a read start to finish kind of book, but there's chapters on, it's all color coded. I think this is backwards on your screen, but it's color coded because I'm like super nerdy. But each chapter, so there's stuff about like your patient rights and mental health and addictions. There is when you have a language barrier, LGBTQ, remote health. I won't go into all of them, but there's end of life. There is self-care when you're a caregiver. Anyways, lots of stuff. And then there's chapters. So it's just different chapters, all color-coded. Lots of resources in here, places to put notes. I'm thinking about writing one of these for a few other countries. I just haven't decided yet. So anyway, it is on Amazon. The link is in my bio, but it's also in the descriptions of all my videos. So anyways, that's all I'm going to say about that. Okay, zombie, you have Behçet's disease or syndrome. Okay, it's a rare chronic condition using inflammation. Oh my goodness, sores in the mouth. Oh, that does not sound fun at all. I'm really sorry to hear that. I hope you're getting joint pain. Oh my goodness. I hope you're getting good care for that. Oh my. Point Fire, hi. Like best wishes from Scarborough on Toronto. Oh, awesome. I'm glad that you're on here. That's great. Another Canadian. Okay. Let me just return. I'm just scrolling here. Just give me 1 second. Zombie, there's a couple of people in the US that have this condition. So that's super rare if like only a handful of people have that. I wonder, I have not encountered a patient that has that, but that's a really good question. I would think that there are not that many specialists out there then, probably for that. Like the more rare the condition, probably the fewer of specialists there are. So I hope that you have one of them, or at least are on a waiting list to get one of them. And I hope your doctor is diving into learning about it, because I have not had somebody with that. So I really don't know much about it. Interesting though. Thank you for sharing that. I love learning new stuff. I don't love that you have that because I imagine that is not fun. And it sounds like it's something that kind of continues to get a bit worse. It progresses a little bit. So, oh, good. You have a rheumatologist. Awesome. Yeah. That's good. And I hope they're familiar with that. That's amazing. Okay. I was going to talk about getting a second opinion. And you guys, if you're on here and you've got questions, or you have, let me just see. We reside in Orange Air Flight Zone, 401 airlifts to St. Mike's. Oh my goodness, interesting. Interesting. I worked I flew with air ambulance for a while, and I worked in trauma ICU and emergency. So yeah, that's very cool. Zombie, you have an endocrinologist too. Okay, good. So you've got both. You might even need an internal medicine specialist at some point. I'm not really sure, but I'm glad you've got an endocrinologist. Yeah, that's great. Okay, so I was going to talk about second opinions quickly here. When to get one, how to get a second opinion. I know in my videos I say it kind of lightly, like, oh, just go get a second opinion if your doctor's not listening to you, or you're not getting good treatment, or if they're wrong or whatever. I know it's not that easy because there's a massive doctor shortage. So I get that. I just want to say that right off the get-go. But they are out there. Like, they do exist. There are nurse practitioners as well that exist, and they're wonderful. Excuse me, I just had the hiccups. They're amazing, actually. So they do exist. It just takes a bit of, it can take some time. It can take some work. So I don't recommend leaving one doctor before another, but getting a second opinion is different. Yeah, so I mean, you can get a second opinion and still keep your doctor. And a good doctor should not get defensive. They shouldn't get offended. They shouldn't take it personally. They should see that as a responsible decision that you make to really cover your bases, especially if you're making a big decision about treatment, right? Like whether to have surgery or whether to get, like, say, chemotherapy or whatever the diagnosis is. So it kind of feels like you're cheating on your doctor, but it's a normal and smart part of healthcare. So when should you get one? When should you get a second opinion? Well, if you receive a serious diagnosis like cancer or a rare disease, the recommended treat, like, so that would be one time to get a second opinion. If it's a really serious diagnosis and you want to just make sure that you've actually got that, or your gut is telling you something's wrong, that would be one reason to get a second opinion. Another reason, the recommended treatment is risky, invasive, or has like lifelong consequences. So I can think right offhand, if someone had prostate cancer and the surgeon or the oncologist recommends getting a prostatectomy, having it removed, the prostate removed, well, there are some lifelong consequences with that. So that might be a time to get a second opinion, right? So, and those consequences are irreversible. Like, once that is removed, they're irreversible. So just getting more than one person. So those are two reasons why you would get a second opinion. You could get a second opinion. Third is your symptoms are not improving after the treatment. So you have a doctor, they make a recommendation for treatment. Your symptoms aren't improving after, so then you start thinking, well, maybe that wasn't the right treatment. Maybe I don't even have the right diagnosis, but you'd want to get a second opinion. So those are three reasons. Fourth reason why you would get a second opinion or could get a second opinion is if you just don't feel comfortable or confident with the diagnosis or with the doctor. Simple. Like, I don't say it's easy, but it's simple. If you just do not agree, like your body's screaming at you that, we do have that small, still voice inside that talks to us, right? That lets us know, it nudges. It's like when you walk into a room and you feel uncomfortable and the little hairs on the back of your head stand up. That's your intuition. That's your, whatever you want to call it. There's a lot of different names for it. But and you just don't feel confident that your doctor's right. You don't think they've got the right diagnosis. You don't think that they're giving you the right treatment. That's 4 reasons to get a second opinion. So how do you do it without feeling guilty? Because some people just feel guilty. They feel like they're basically cheating on their doctor. You don't need your current doctor's permission. It's your right to have a second opinion. So if you're in the States or where there's insurance, you can ask your insurance provider for a list of in-network specialists. In Canada, we don't have to go through insurance providers, but you can still go through a list, like do a search for other providers, probably not in the same clinic, but in the same region that are specialists for what you need. And you can ask, like, politely, you got to be polite, ask the front desk of your doctor's office, I need a copy of my recent records and test results for my own files. You don't have to say it's for a second opinion, but just say you want a copy, because that's going to be really helpful when you go get a second opinion, because they don't want to have to pay, the system won't pay for another whole set of tests. So you want those results. So it's not about finding, the other thing too, it's not about finding a doctor who tells you what you want to hear, right? There are patients out there who make a decision of what they have or what's wrong with them, and it's actually not correct, right? So it's not about finding a doctor that tells you what you want to hear, or that don't have cancer. You want to find out the truth, right? It's about finding clarity and confidence in your treatment plan. So anyway, that's kind of my little talk, or what I was thinking about for getting second opinion. So I'm going to pause there. I'm going to scroll in the down here and make sure I don't miss anything. So Point Fire, you reside in okay, yeah, you told me that. I already read that one. Think about you when they fly over. You're a brave lady. Oh, thank you. Thank you. Zombie, have you ever encountered a patient with toxic epidermal necrolysis? I have, actually. Arsh, you take biologic Humira. Okay, so you've done, so if you don't know, the biologics are kind of, how do I describe them? They're biologics, like it's more the natural sort of side of things. That's how I'll explain it. Okay. And then Zombie's asking Arsh sort of some questions. Okay. So Point Fire, you served in the Armored Corps. A lot of soldiers applied as observers for 444 Squadron helicopters. I'm aware of the dangers you face. Oh, thank you. Yeah, so that's part of it. And then also, like, an air ambulance can land, like, come out of a hospital, right? So when I worked in the trauma unit, there was a few of us that would be on call for the air ambulance, and we had a helicopter and a fixed wing. So when there was something that it would, usually it was on the highway somewhere in a mountain pass or down in a valley where it would just be way too long to get an ambulance, like a road ambulance there, or it was a rescue situation. Yeah. So anyway, thank you for that. I appreciate it. Okay, so if you guys don't have, I don't know if you have any other questions or not. I'm just scrolling here. Some really, really awesome input. So thank you guys. Let me just see here. Make sure I'm not missing anything. Oh, Unique. I just totally missed you. Oh, that's so funny. Mama B has your back. So thank you for saying hi. I totally missed you on there. I saw Mama B has your back, but I didn't realize who it was. Oh my goodness, that's hilarious. So I have some really awesome people that are always on my lives on TikTok, and I started doing more on YouTube just to change it up a little bit. But I'm still doing both. But anyways, Unique is on one name in TikTok and a different name on here. So that's funny. That kind of threw me off. And I just saw it. I totally missed it before. So I'm glad that I scrolled again. That's awesome. Let me just double check. You guys, if I do miss something, please let me know. I feel like I probably have missed some, but keep you on your toes. I know, right? Oh my goodness. Oh, that's hilarious. Arsh, how many people have you seen taking biologics? So I've known quite a lot of people actually that take biologics for different things. Not necessarily for what you take it for, but lots of different things. Like a lot of women in menopause take biologics. There's people that have different types of cancer diagnosis that are, lots of different. I have a couple of really good friends that are nurse practitioners too, and they've taught me a lot about biologics. So yeah, thanks for sharing that. I appreciate it. Okay, oops. I think I pushed, there we go. Okay, you guys, well, I'm gonna sign off. If you guys don't have any other questions, I'm gonna sign off. This video will stay up here this week. When am I going to do? I might come on Tuesday evening at 5:30 Pacific time, I think is when I'll come on. Oh gosh, that's just in 2 days. I wonder if there's enough for me to talk about in 2 days. I'll see. I'll try and come on at least for a little bit. I don't usually, the lives, on YouTube aren't as long because they stay up. Like the ones on TikTok kind of disappear as soon as they're done. These ones actually stay on my channel for indefinitely until I take them off. So I try not to have too much downtime and too much dead space. And they tend to be shorter for that reason too. So anyways, I love you guys. Thank you for participating, and I will see you next time. See you later. Have a good rest of your Sunday.